The use of restraints and seclusion for people with autism and other developmental disabilities.
Hi, my name is Sina, and I'm a behavior assistant. I work for a school district, and I'm in my master's program in ABA and hope to graduate in the fall. And I am working towards my BCBA.
Hi, I'm Alexandra. I'm an RBT and a lead ABA therapist at my school district, and I hope to become a BCBA in 2019.
Hi, my name's Kristen. I'm a middle school special education teacher, and I'm in my 4th semester of the ABA graduate program.
Hi, my name is Caitlin. I currently work at a center-based program school, and this is my 3rd semester in the ABA graduate program.
And I'm Lauren. I'm also in my 3rd semester, and I currently work as a supervisor for a service provider with people with developmental disabilities.
So what are restraints and seclusion? There are 3 types of restraints. The first type is a physical. A physical restraint is also known as an interpersonal restraint, and it involves the use of physical force to restrict movement. They use a variety of holding techniques with the least amount of force necessary. When in a restraint, the individual may be positioned on their back or on their stomach. The second is a mechanical, which is also known as a depersonal restraint, and it includes leather or cloth straps, cuffs or belts for the wrist, ankle, waist, chest, or knee. And then there's also a papoose board, a 4- and 5-point restraint, a calming blanket, body jackets, and geriatric chairs. The third type of restraint is a chemical restraint, which is used to restrict the individual's movement or normal function of a part of the body. These restraints include sedative antihistamines and neuroleptics such as thorazine, chlorpromazine, and haloperidol. And then what seclusion is isolation, which is defined as any act of separating the individual from the group. It can be initiated voluntarily or involuntarily, and it can be in a locked or unlocked room. Introduction. So individuals with autism or other developmental disabilities may engage in severe aggressive and SIB. This poses a significant threat to itself, peers, staff, family members, and anyone else in proximity. The Ethical Code promotes the use of least restrictive procedures. However, those providing services to individuals with severe POM behavior may consider the use of restraints and/or seclusion, stating that these are necessary to prevent severe self-harm or harm to others. Today's debate will focus on the following: if restraints and seclusion are ethical, the role a behavior analyst plays in interventions involving restraints and seclusion, and some of the literature and ethical codes regarding restraints and seclusion. Introduction of roles. Myself will be acting as the moderator of the debate. For the use of restraints and seclusion, the pro side will be Kristen, Lauren, and Sina. I'll be stating the main points. Lauren will be proving the pro points through evidence collected, and Sina will be acting as the attacker. Against the use of restraints and seclusion, or the con side, is Caitlin and Alexandra. Alexandra will be stating the main points, and Caitlin will be proving the con side of the debate with evidence as well as attacking. Before we get started, there are 4 main rules of this debate. Number 1 is to communicate respect and professionalism at all times. Number 2, adhere to the time limits that have been set. Number 3, do not interrupt others. Speak only when it is your turn in the debate. Each role has 5 minutes to speak. Let's begin. For the pro restraints and seclusion, the stater. Restraints and seclusion are necessary. They're necessary and seem useful as the last resort, and they're used only for the most aggressive behavior. The behavior analyst should have a documented plan or procedure when they are used, and it's only to be used for those who are trained in an approved program. When used as the last resort, before initiating restraints and seclusion, the following should be considered: de-escalation strategies, deep breathing, client-initiated break in a calm, quiet area, sensory-based fidgets, such as a fan, a stress ball, resistance band, and many others. And then you also have to think risk of harm to others. Are other staff or clients in the immediate area at risk? And also risk of harm to self. If the client continues this behavior, will he or she be harmed? Used for only the most aggressive behavior. Consider the topography of the behavior before intervening. So I have a few questions to ask. Is hitting the table with an open hand reason for restraint? Is clenching your fist and charging towards someone reason for restraint? Probably the second is reason for restraint because they are charging towards someone and someone could be at risk. When they're slamming the table with their hand, they're not harming themselves and they're not harming others. Next is, if a client is cursing, should they be put into seclusion? If a client is making a death threat with specific details, including objects in the immediate area, should they be put into seclusion? Well, cursing, it may be inappropriate or seen as disrespectful, but it does not harm anybody physically. However, when you're making a death threat and you're using specific details, that could be an imminent risk to themselves. So each individualized instance of behavior should be considered before deciding whether to restrain or to seclude. Behavior analysts should have a documented plan or procedure. This prevents any unnecessary physical measures or seclusion. It should be documented in either the IEP, the BEP, or a behavior procedure plan. It should be reviewed regularly with all trained professionals that work with the client. The type of restraint or seclusion that's effective should also be documented. For example, when John engages in headbanging, a one-person transport hold is effective for decreasing his ability to headbang. Only for those trained in an approved program. It must be the program that the school district, the hospital, or the agency uses to train their staff. This results in all the staff using and knowing the same techniques and strategies. This also minimizes the chance for any injury that would happen to either the individual or the people involved in the restraint. Parents, guardians, or clients must be informed of the possibility of restraints or seclusion being used. And they must keep certification current, have annual recertifications, use weekly reviews of restraint techniques, and have competency checks. On restraints and seclusion, the stater.
Restraint is defined as any physical method of restricting an individual's freedom of movement, physical activity, or normal access to his or her own body. This is a common intervention used amongst individuals with autism. There are three types of restraint procedures: mechanical, using an object to restrain; ambulatory or physical, using your body to enable a hold; or chemical, using medication. All holds are used with the intention to establish behavioral control and restrict movement. Uses of restraint and seclusion. The use of restraints and seclusion is commonly practiced by staff in residential facilities to manage disruptive behavior. In addition, this form of intervention is also being used in the general education setting. What not to do. Restraint should never be used to punish or to force someone to comply. The main purpose of a restraint is to get behavioral control when a student is at risk to themselves or others. Restraint should never be performed by someone who has not been trained. In order to implement a restraint, one must be trained and in most cases pass a test. However, it is debated whether or not most training is adequate and meets a level of mastery when implementing restraints. A restraint is considered a form of intervention, but is it the best intervention? According to the United States Department of Education, physical restraint or seclusion should not be used except in situations where the child's behavior poses imminent danger or serious physical harm to self or others, and other interventions are ineffective and should be discontinued as soon as imminent danger or serious physical harm to self or others has dissipated.
Pro-restraints and seclusion, the prover.
The use of physical restraints in supporting literature. According to a study by Louis Salit in 2008, physical restraints are used with people with intellectual disabilities to manage emergency situations. These restraints can also be used as a part of a planned intervention as long as there is a comprehensive behavior support protocol in place. The objective of the planned intervention is to reduce and eventually eliminate serious behaviors such as aggression, self-injury, and property destruction. This study found that the use of fading with a fixed time-release physical restraint intervention was able to reduce and then eliminate the physical restraint, with the target behavior of aggression reducing as well. Risk of self-injurious behavior and supporting literature. According to De Rosa et al. In 2015, self-injurious behavior can cause tissue damage, infections, bleeding, and the individual to have to be in a more restrictive environment at school. To decrease self-injurious behavior or the risk of harm to the individual, protective equipment is sometimes necessary. Their study found that the use of arm splints decreased self-injurious behavior in 2 individuals who displayed severe behaviors. Seclusion. Examples of seclusion are shown on this slide. The top picture shows a seclusion room with a half door. You can also see there are pictures on the wall with visual cues for the individual. The bottom left shows a padded room with a beanbag chair to keep the individual safe from harming themselves. The picture on the bottom right shows a seclusion room that is built into the classroom. According to Cleary, Hunt, and Walter in 2010, aggression and violence are common occurrences in inpatient psychiatric settings. They found that staff in those settings had a 10% chance of being injured as a result of these violent behaviors. Seclusion can be used to prevent injury of the client and others, including staff and visitors, and many staff perceive it to be necessary. The use of seclusion must be authorized and strictly monitored. Seclusion is still a reality, and it's questioned if facilities can operate safely without it. It may be considered unethical to ignore the use of seclusion when other alternatives have failed. Ethical Code 4.05 describe behavior change programs. Behavior analysts describe in writing the objectives of the behavior change program to the client before attempting to implement the program. This means that before restraints or seclusion were used, they were explained to the client and or the parents and guardians. To the extent possible, a risk-benefit analysis should be conducted on the procedures to be implemented to reach the objective. Ideally, the benefits of each procedure would outweigh the risks. The description of program objectives and the means by which they will be accomplished is an ongoing process throughout the duration of the client-practitioner relationship. The objective should change as the client makes progress. Ethical Code 4.08, considerations regarding punishment procedures. Behavior analysts recommend reinforcement rather than punishment whenever possible. If punishment procedures are necessary, behavior analysts always include reinforcement procedures for alternative behavior in the behavior change program. Before implementing punishment-based procedures, behavior analysts ensure that appropriate steps have been taken to implement reinforcement-based procedures unless the severity or dangerousness of the behavior necessitates immediate use of aversive procedures. Behavior analysts ensure that aversive procedures are accompanied by an increased level of training, supervision, and oversight. Behavior analysts must evaluate the effectiveness of aversive procedures in a timely manner and modify the behavior change program if it is ineffective. Behavior analysts always include a plan to discontinue the use of aversive procedures when no longer needed.
Con restraints and seclusion, the prover.
Now, when we're looking at restraints and seclusions, we want to know, is this a safe intervention? According to the Child Welfare League of America, it was estimated that between 8 and 10 children in the United States die each year due to restraint, while numerous others suffer injuries such as bites, damaged joints, broken bones, and friction burns, which can be skin-on-skin contact or skin-on-surface like tables, chairs, or floors. The Hartford Courant, a Connecticut newspaper, reported that 142 restraint-related deaths, which 33% were caused by asphyxia, occurred in the United States over a 10-year period. Here is just a graph to show the results of restraints on students. And as you can see, it can cause physical injury, physical pain, emotional trauma, and other adverse reactions. So only 7 states in the United States restrict the use of restraints, and 17 states require training prior to the use of restraint. This means that 26 states do not require any training or restrict any use of restraint or seclusion. So, again, is this a safe intervention? All school staff should have a mandatory conflict de-escalation or preventative escalation training, as well as conflict de-escalation techniques should be employed by all staff. Mechanical or chemical restraint should never be used in school settings when their purpose is to simply manage or address a child or youth's behavior. Neither restraint nor seclusion should be used as a punishment to force compliance or as a substitute for an appropriate support. When used as a punisher, in the face of punishers such as restraints and seclusions, the individual will exhibit 4 behaviors. So number 1, they will strike back. 2, they will become withdrawn for hours, thus preventing the learning to continue. 3, they will engage in escape or avoidance behaviors. And 4, they will become conditioned to fear and avoid the person or setting in which the restraint or seclusion has occurred. Improper implementation can be caused by numerous things. Number 1, it can be caused by a lack of training, and that's probably the biggest thing. 2, the training is not current or it is outdated. 3, there is not a behavior plan in place. And 4, when intervention is needed, it is difficult to implement due to surrounding conditions or environmental instability. So this poses a question: how can a person truly master or hold a restraint and implement with 100% accuracy when they only learned and practiced the restraint for a number of hours in one day? The ethical compliance codes that can be violated with use of restraints and seclusions are 409, which is the least restrictive procedures, which states that behavior analysts review and appraise the restrictiveness of procedures and always recommend the least restrictive that are likely to be effective. So instead of going straight to physical intervention, finding something to prevent that or de-escalate a behavior from getting to that point. 702, which is the ethical violation by others and risk of harm. So that states that behavior analysts believe there might be a legal or ethical violation. They will first determine whether there is a potential for harm or a legal violation, a mandatory reporting condition or agency, so they're addressing the violation. The second part of that is if a client's legal rights are being violated or there's potential harm, that they will take necessary action to protect the client.
Pro-restraints and seclusion, the attacker.
So let's talk about the purpose of the restraints and seclusions. So use of restraints and seclusions do have a purpose, and the purpose is not to force compliance on an individual. The purpose is to keep the individual safe from harm due to uncontrollable, violent, and aggressive behavior that is engaging in self-injurious behavior, and also to keep others safe from their behavior. This can happen in schools, in hospitals, in homes, in mental health facilities. In schools, as an example, is attacking other children. Hospitals, you know, if they have an IV and they start ripping out the IV because they're not aware of their situation, you know, that's a reason to use the restraint. In homes, if they're attacking other siblings, their parents, that's the reason. And in mental facilities, obviously, you know, if they cannot control their physical actions, unfortunately, they do use the restraints because that's how they are able to kind of calm and maintain that individual. So on the right side, there is a story about a mother, and if you click on the link, she will kind of explain to you what happens in her home and an example of, you know, what happens when her child is engaging in dangerous behavior. So there's 2 types of aggressive behavior. We have verbal behavior, which can be assisted with verbal intervention, so such as aggressive tone, angry facial expressions, verbal threats, verbal comments, and language. Now, when you're talking about risk behavior, you know, sometimes it is it needs to be dealt with physical intervention. You know, when they're hurting oneself or hurting others, if they're hallucinating, lack of awareness of movements, and, you know, object aggression. There's a lot of talk about code violations, and I know Ethical Code 4.9 says least restrictive procedures, but according to the Association of Behavioral Analysis International, they strongly oppose of inappropriate and unnecessary use of seclusions, restraints, and other intrusive interventions. However, use of restrictive intervention and seclusion may be necessary in some cases. So, you know, the link below will kind of explain a little bit more. And is the purpose that simple to manage or address a child or youth's aggressive behavior? If you actually think about it, is it really that simple to manage and, you know, talk to a child or an individual when they are in a time where they just cannot, you know, balance themselves out? You know, if they're that angry and they're that upset and they're using physical anger, I mean, can you really talk somebody down at that time? And do you always know when that's about to happen? You know, I mean, I don't always know when one of my students are about to have a tantrum, because every day is a different day. And, you know, it could be one person walking in that they don't like, and the next day that same person will walk in and they'll be just fine. So no, it's not something that simple where you always know. The Congress of Education Department in 2010 tried to pass a federal policy restricting practices, but it didn't go through. So instead they wanted everyone to have it written in the student's IEP. Education Department released a document outlining 15 principles that states could use to individualize their plan on using and reducing restraints and seclusion. So again, there's a link below if you want more information on that. States are required to explain how they will reduce, not eliminate, the use of restraints and seclusion required by the Every Student Succeeds Act, which passed in 2015. Out of 50 states, 8 do not have a formal policy as of yet. But again, there's a link below, and each state will have specific policies and rules to follow concerning restraints and seclusion. The 15 principles, if you look on the right, it says make every effort to prevent the use of restraint and seclusion. School should not use mechanical restraints. Use only when child poses imminent danger to self and others. Should apply to all children and not only with disabilities. So the U.S. Department of Education, the OCR, and the Substance Abuse of Mental Health Services require states, local school districts, and parents and stakeholders to implement policies that are written on the right, and there's more information on the link below. So the OCR states that use of restraints or seclusions may discriminate individuals with disabilities in violation of Section 504. But the OCR also will find it to be justified in response to restraints to seclude a student with a disability in situations if the student poses imminent danger or physical harm to self or others. So again, if the student poses imminent danger or physical harm to self or others. So this is some data that I pulled up. 50.7 million students, 13,000 districts, 89,000 schools, 6.6 million children under the IDEA Act. 1 out of 5 districts were restrained or secluded. 70,000 students under the IDEA Act were restrained and secluded in 2013 and 14. And 4 out of 5 are males. And the links below will give you a little bit more information on that. And I just want to kind of finish off at the end with, we just had one of our students from our district. They were on the highway. This student never had done anything like this before, decided he was upset that they could not go to Dairy Queen. He jumped out of the moving car on the highway. He was running down the highway. There was traffic everywhere. There was police cars everywhere. They were chasing him down. They had to restrain him. And this is the reason why. So again, I want to kind of, you know, have everyone think about, hey, can you really stop a behavior before it happens at all times? No, you can't. And this is the reason why restraint and seclusion comes into play. And if anyone has ever had to restrain an individual before, that is not a very simple task either. It's not something that we all jump forward and to look forward to, because it's very, very difficult. It's very, it takes a lot of energy mentally, physically, and emotionally. And so again, as we stated, it's something that is used as a last resort, but it is something that is also, that can happen.
Con restraints and seclusion, the attacker.
So before I want to go into our argument, I just wanted to address some of the stuff that the pro side just talked about. So Sina just talked about how you don't know how, like, if they're, when an aggressive behavior is gonna occur, and it's not always, you know, the same or reliable. But the thing is, it's not about knowing when it's gonna occur. It's about the amount of training to reduce a behavior from happening. So not necessarily sitting there and knowing, okay, this is going to happen, but being trained to know what to happen when it starts to go that way. Also, in her statistics, it had 89,000 schools, and then it had total in the United States, and then it had 70,000 incidents of restraints. So, I mean, that's almost one per school, one incident at least per school. And to be honest, that's still too high of a number. Okay, so we're going to talk about understanding the behavior. So one way to prevent physical harm from physical intervention is to understand the behavior and understand how to prevent it from escalating, de-escalating. So before you go into use physical interventions, you must understand the behavior and the function of the behavior. So what does a child want or need? What are they trying to communicate? What are they trying to tell you? Is the behavior reoccurring? Have you seen the behavior before? What does it look like? What's the severity of it? If it's, you know, a simple slamming a book on the floor, does that constitute restraint? No. Is there a way to stop the behavior before it becomes dangerous? Is there a way to stop it from escalating, obviously, to restraint or seclusion? Is there a need to put a hands on a child? So staff are not assessing or analyzing situations properly or understanding the function of behaviors, and they're going straight to holds with individuals, and this is obviously not being effective and causing harm. So most behaviors can be stopped before physical intervention is needed. Many behaviors are predictable for the individual. You've seen it before. You know where it's going to go from A to B to C. So understanding the behavior can definitely help with the prevention and de-escalation. Knowing how to stop the behavior from becoming dangerous rids it of physical intervention. Here are the 15 principles that were shown by the pro side, and I'm not going to read through all of them, but I do want to make a point that number one was make every effort to prevent the use of restraint and seclusion. There are a lot of places that are not putting in or not doing the training, who don't know different interventions to use to prevent the use of restraint. They are actually just using physical restraint. So they really need to learn how to prevent going that direction. So also I want to note number 6, they do not using it as a punishment, don't limit the child's breathing, and then number 10, teachers and personnel should be properly trained and monitored. So according to Schloss and Smith, the use of restraints make it more likely for inappropriate behavior to reoccur. So let's say there's a student who's throwing a book on the floor. They're throwing that on the floor, and you're, you know, taking the book away. Well, they might continue to do that if they're trying to get your attention. Once the student learns that he will be physically blocked from performing the response, he is likely to increase his efforts to perform it. Untrained and uneducated. Those who are untrained and uneducated in physical intervention are the most likely to misuse it. So staff jump into physical action when they're unaware of how to deal with the behavior properly, and they aren't trained to know how to deal with it properly or implement proper intervention. So in order for this to end, all staff must be trained. And also, there needs to be a plan in place to describe which interventions work, how to go about it, protocol, all that. So according to the U.S. Department of Education, in cases where students have a history of dangerous behaviors for which restraint and seclusion were considered or used, a school should have a plan for 1, teaching and supporting more appropriate behaviors, and 2, determining positive methods to prevent behavioral escalations that have previously resulted in the use of restraint and seclusion. So why is it dangerous? Most seclusion and restraint techniques are being used by uneducated and untrained people who think that they're qualified, who don't have the amount of hours or the amount of time using the techniques. It's being used on students who haven't exhibited any behavior that warrants physical intervention. It should only be used, if there's a plan in place, explaining why to use it, when to use it, how to use it, also interventions that can be used before as preventative techniques. It's not being used as a last resort, it's being used before then. And it's seen as acceptable, although it is unethical when it is used improperly and is causing harm and death. And lastly, I just want to show you a graph. This was from the 2011 to 2012 and 2012 to 2013 school years. Now, if you can see the total restraint and seclusion incidents, that's about 35,000 kids or individuals who have been restrained and secluded. Yes, it did go down a little bit during the next year, but those are still astounding numbers, and it should not be that high. If we knew how to prevent such behaviors or use other interventions, then these numbers could definitely go down.
For restraints and seclusion, the stater. So some of the final arguments that we want to make is that one of the main arguments of the con side is that injuries occur from restraints. And while this is sometimes true, they are also preventable. We can prevent these injuries to ensure that as behavior analysts, we do no harm. What does trained and qualified mean? It means to attend a training session taught by professionals. It must be endorsed by a program specializing in crisis intervention, restraints, and behavior management. Demonstrates the ability to fluently perform each restraint. And complete a written competency test that pairs with the physical restraints. This is when it includes de-escalation strategies, antecedent strategies, effective communication, and knowing when to initiate restraints versus non-physical interventions. And this also includes attending recertification courses when appropriate. Some of the examples of behavior management or crisis management programs include safety care, the MANT system, Handle with Care, and PMT. Also, another main argument of the con side is that all behaviors can be prevented. However, some behaviors cannot. And even if we know the function and use antecedent or de-escalation techniques and strategies, they can still occur. Individuals are unique and they're always changing, so the function of the behavior can change. That means the replacement behavior we may have taught may no longer be effective. Individuals may not demonstrate any antecedents of behavior and react impulsively in an aggressive manner. This could be for numerous reasons. It could be because of a psychological disorder or some kind of previous trauma, such as child abuse or sexual abuse. So what can we do instead? Instead, we can ensure a safe environment with minimal objects that can become dangerous. We can provide structure in the room to allow for quick and safe removal for other individuals. And we can be prepared and trained for what to do if and when the individual becomes aggressive. So lastly, to decrease the harmful effects of restraints and seclusion that the con side discussed, it is important to understand that restraints and seclusion should only be used for the main reasons of as a last resort for the safety and individuals of others, for the most aggressive behaviors towards self and others, when there's a documented plan and procedure by qualified and trained professionals, and then to prevent any unnecessary physical or psychological harm. And I'll leave you with asking these 3 questions when regarding restraint and seclusion. Is there imminent risk? Is there no other way to prevent harm? Is the risk of not intervening greater than the risk of intervening? If the answer is yes to any of these questions, then a restraint or seclusion is the safer choice for the individual and others in the environment. Con, restraints, and seclusion. Stater.
As behavior analysts, we are to always implement enforcement over any form of punishment, and always rather the use of restraints and seclusion. Not only is this an expectation, but it is a duty that's enforced within our ethical codes. While restraints are being used as an intervention, they are not being implemented accurately and are not always being used as a last resort. Restraints and seclusion are being used without any training. Some states do not require training. Without proper training, we have to ask ourselves, is an hour session truly enough time? Without practice training, most holds are forgotten if not practiced, and we all can attest to that. Restraints and seclusion have caused physical harm, mental, emotional harm, resistance to those to implement. For example, if a teacher had to implement a restraint, that student is going to resist that teacher for a very long time, and even death. I mean, that's huge right there. Restraints and seclusions do not promote reinforcement of appropriate or replacement behavior, and it doesn't establish learning. For example, one thing that we discussed earlier when we were going through our whole debate was, for example, a mechanical restraint. A little girl that I work with, they have her arms in braces so that she doesn't pull out her eyelashes or her hair. That way she can't bend her arms to have access to her face. What is she learning? Granted, those braces stop her from hurting herself, but she's not learning a replacement behavior. Also, is this being generalized? When she goes home, those braces come off. What happens at the home? Maybe if we had enough money to give her a shadow during her school day, there would be learning, but we don't, so we're putting her in braces. So it's just one of those questions that we have to raise, like, is this really the best and most effective treatment? Sina mentioned the situation on the highway. Completely agree. That is a time when someone's life is at danger, and we need to intervene immediately. I just think, and Caitlin will agree with me, as far as the BACB, they probably need to reevaluate how often the restraints and the holds are being used. We do agree that they should be used as a last resort, and we do agree that it's good for safety reasons, but we just need to evaluate everything in whole. In conclusion, we somewhat agree with those who are pro-restraint seclusion. Yes, these interventions should be used as last resort with proper training. However, given the evidence presented, this is not occurring. Due to insufficient training or lack thereof and improper implementation, the use of restraints and seclusion should be investigated and reconsidered by the BACB to ensure safety of those who experience this intervention.
So today we have debated the use of restraints and seclusion for people with autism and other developmental disabilities. We have heard reasons why they should be used and why they should not be. So after hearing both sides of the argument, what do you think? What questions do you have? Thank you.
Thank you.
Thank you.
Thanks.
Thank you.